In terms of exercise capacity, we found that all programs improved roughly about the same. The improvement depended less on the centres and the type of programs that the patients did, but it depended more on the type of surgery or intervention the patients had. So all the patients that had actually open chest surgery, they recovered a lot more from just after the surgery then to the 1 year follow-up. And we found it was sustainable, so they recovered and then plus or minus remained on that level. This was with regard to exercise capacity, and then we had other outcomes, for example, blood pressure goals. They were not very well maintained. They were overall quite good, but not very well maintained. And in terms of their blood fat or blood lipid levels, these results were also not very good. They improved a little bit during rehab, but then this improvement was lost, and in fact the levels were worse at 12 months than they were before rehab. So we have kind of mixed results, but there were no differences between centres, with centres doing inpatient rehab short programs and those that did longer programs. The overall improvement in exercise capacity was quite small. It was larger in patients after surgery, probably mostly due to spontaneous recovery, and it was relatively small in those with minimally invasive surgery. And at this stage, we don't really know how clinically meaningful this is. It was significant, but it was a large study, and therefore you quickly achieve significant results. But the clinical benefit at this stage, we're not quite sure. In terms of secondary outcomes, with regard to compliance to drugs that lower the blood lipids or lower blood pressure, there is definitely room for improvement, and maybe more information should be given to the patients.